I'm very pleased to introduce Dr. Alan Siegel, who is the co-founder and executive director of Social Prescribing USA, the leading U.S. social prescribing advocacy organization. He's a family physician at Kaiser Permanente in Oakland, and for the last 2 decades at Contra Costa Health, he led an Arts in Health program for patients and staff and led many projects in social prescribing, a Nature RX program to bring patients with pediatric obesity and chronic disease to Bay Area regional parks, and he helped start the Health Leads program at CCH to address social determinants of health. As a founding board member of the National Organization for Arts in Health, he initiated a project to bring the arts to healthcare workers to address burnout during COVID, and he also provided leadership to the renowned Martinez Family Medicine Residency Program. Alan contributed to a 2024 article on global aging in Forbes, and last month co-authored an article in Generations Today on the path towards universal social prescribing in the U.S. I'd also like to introduce our next speaker for today, Teresa Tam, who is the Social Connection Program Coordinator for the Greenwood Senior Center Phinney Neighborhood Association in Seattle. For the past 4 years, she has developed and connected people to activities that reduce social isolation and loneliness, both at the Greenwood Senior Center and in the community. She also has over a decade of experience in federal healthcare program evaluation with the U.S. Government Accountability Office. I think you can see that they have tremendous expertise to share with us about social prescribing and social connection. Welcome to both of you.
Thank you very much, Barbara.
Thank
So
you.
thank you very much for having us here today. We are going to talk a bit about social prescribing and talk about some programs that are piloting it, and then also talk about how you can get involved, both locally and nationally. But first, I'm going to talk a bit about where I came from with this work. As Barbara mentioned, I spent the last 25 years at Contra Costa Health, which is Northern California. And if you go back a few years from there, I finished residency program. And really a big motivation for me is that during my 3rd year of residency, I went through my own major depression, and which was about the hardest 6 months of my life. And what I was offered all the things that we have to offer, medications, therapy, but still it went on for 6 months and was tough. And I am pretty dedicated to trying to bring more resources to be able to heal that we're kind of stuck in a certain paradigm, and we want to kind of blow that paradigm up and do things a little bit differently. So we're going to talk to you today about some of those things. So as Barbara mentioned, I was at Contra Costa Health. You can see some of the things that we did. We had an expressive arts therapy program where we brought arts to the bedside. The second one is a 4-inch canvas project where we would be able to have staff members talk about hope and gratitude, not talk about, but draw and paint around hope and gratitude and then put it together. That was a harp in the ICU. We had some weekend workshop programs where people would share at a level that I've never seen before that I think was really related to the arts component, healing environments. And then Barbara also mentioned that I got to do a couple other programs. This is one of the programs that we did annually. I think we got up to 15 years, Healing Through Creativity Fair, where we would have staff members get up and perform. My own band came from this kind of organically, but other people would perform dance or they do poetry, and people would show each other their art. It was kind of a beautiful thing. And so a lot of people thought this was their best day at the county. And, it was a really powerful thing to see that. I would suggest you do it in your own institutions. And this is a couple pictures from our Walk with the Doc program. I was able to secure some funding from the city where my clinic was located, and we did this program where we took kids. I was working in pediatric obesity at the time, doing groups, and we had kids and their families and other patients of mine, and we would do some education at the clinic, and then we would take them out to our regional parks. We are in an amazing area for nature, and we went out to 6 different regional parks and had programming around Zumba and yoga. We would have hands-on expressive arts therapy. We would have healing food, and we'd have live music and kind of do it all. Whatever it was, it kind of worked. And I got to hear about it for years to come from my patients who would basically tell me, especially this one Iranian patient I remember, who would basically just every time he came in and saw me, he would tell me just how powerful that experience was. So I got a lot of these messages of things that I'm trying to advocate for nationally from the work that I did in Contra Costa. And I'm sorry this looks funny. Um, Lost in translation there. But we are at a moment, especially post-COVID, where a lot of problems have come together in one place. And I think that that opens up the possibility of doing things differently. I think we've been doing things a certain way for a really long time. And so I want to talk about a couple of those problems. So we know that there's a mental health crisis. About a fifth of the population have anxiety, depression. We have the highest suicide rates in the world. We have a loneliness crisis. About 50% of people are lonely, and that goes up to about 63% if you take people who make less than $50,000 a year. Social isolation in older population costs us $6.7 billion extra, so we can't really afford this crisis. Healthcare worker crisis, as probably many of you know, it's very hard to find doctors or nurses or people out there. About 25% of people who are clinicians have left practice, and another 20% are expected to leave in the next 2 years. So we have to treat our people well and make sure they're happy. We have an aging crisis where 20% of the population will be more than 65 coming up in about 5 years. And so that just brings in all kinds of challenges and work for all of you. But to a healthcare system, we will have less people contributing money towards working and taxes, and we will have more people more ill and also needing caretakers and lots of issues that come up around a large population of people who are aging. And then social capital crisis. Some of you may have heard of this before, but a guy named Robert Putnam, who was a social psychologist out of Harvard, wrote a book called Bowling Alone 20 years ago, and then had a movie called Join or Die, which came out in the last year or two. You can now get it on Netflix. At first, you had to do it in a group of people, but now you can actually watch it at home by yourself, I guess. But it basically talks about how we have lost a lot of social capital where people used to be joined to the PTA or to the Rotary Club, and that how well a society does is based on this social capital thing and how connected people are to other people in their community. So I know that Teresa is going to talk about loneliness and what are the effects of it, but I just thought briefly I would talk about how well are we doing as healthcare professionals to estimate social connection, social disconnection. And if you look at this graph, the ones on the right side are the ones that you would kind of expect. We're really good at asking about medications and flu shots and alcohol. But if you look at the left side of the graph, we are pretty terrible at asking around social connection. So I'm going to bring up a patient. Patient Maria shows up in your clinic on a late Friday. She went to the ER a few nights ago with heart palpitations and tightness in her chest. And this really was a common patient who I would see. They would have an EKG, check their labs. They didn't have a heart attack. All that was normal, and were diagnosed with panic attacks and anxiety and told to see their PCP. So they would come back and see me. So you would see her and her anxiety was clear. You asked her what was going on. And if you start to get into it, you find out it's about she doesn't have enough food to feed her 3 children and that her family just moved away. And so she was strained by feeling isolated and a lack of community. You diagnose with panic attacks and anxiety. And what do you have to offer? Of course, as I mentioned, you have medications and you have therapy. So we'll get back to her and we'll see if we can maybe do better. But what if what doctors prescribe is more than just medication? And not just doctors. We really talk about all health professionals can be prescribing. And eventually we would love for anyone to be able to be prescribed, even prescribing themselves and by anyone in the community. But I think we're starting off with working with the healthcare system because that seems to be where the best direction is to go to try to get this moving more in the States. But what if you prescribe something that could improve your anxiety, your PTSD, your chronic disease, diabetes, heart disease, really no side effects, cheap, improve loneliness, and make people more connected. So social prescribing is really a different kind of model. It's a model for healthcare, not really sick care, but it does do sick care. I think it's a little bit not quite true because we also think a lot of these things can work for people who are sick. We know that the interventions work for sick people, but I think we want to look as we move forward at what can we do to prevent problems. So we've had some really amazing studies coming out in the last several years. They've done meta-analysis of 3,000 studies around the arts and found just how good they are around mental health, um, cognitively for Alzheimer's disease, music for stroke patients. And if you look at nature, also time in nature, also it can be as little as 10 minutes a week, but really can affect anxiety, depression, decrease blood pressure. So let's think about how do we really use some of these tools that we have at our disposal rather than just be limited by what we've always done. So one of the most important parts of this work is that we ask really the key question to all of this is what matters to you. And I love that this is the question, one of the four things that Barbara brought up, that what matters to our aging population is really the question we should be asking to every patient. I agree with that completely. And we'll cover that, and we'll also cover mentation. I think we'll cover meds a little bit less. And so anyway, this question, if you just ask people what matters to you, you can really get to find this information out. And we don't ask this question that often, and we really just need to be asking it because I think we'll be pretty surprised when we start asking the right questions of what it is that people want to do and that they're not doing. And their priorities probably don't always line up with our priorities. So this is a model of social prescribing, where the primary care provider assesses the need for social prescribing. They refer, in the UK, they use what's called a link worker. And one of the things that the UK has really done is that they provided link workers for the whole country. As of 2018, they had these people called link workers who would connect with the community and they would find out what's going on. And then they would talk to the patient, find out what matters to them. And then they would really match those things up with what's available in the community. And this has now spread to 32 plus countries around the world. It seems to be growing pretty quickly. As I mentioned, it's scaled in the UK, and other countries are really at different stages. And in the US, we have at least 40, probably more than that at this point, pilots. There's going to be a study coming out shortly. I'm waiting for it any day now, that goes over about 23 of those programs. And we can find out more about what's working, what's not working. So if I go back to the crisis that we talked about before, we have our mental health crisis, and we have 40 years of evidence for arts and lots of evidence now for nature. What about our loneliness crisis? Vivek Murthy was amazing at going around the country and around the world to really bring this to people's attention, that loneliness is a huge issue. It's not just huge in how common it is, but the way that it affects the body and strokes and dementia and heart attacks and all of these things that we do care about. It's incredible. So social prescribing really is part of the answer for this loneliness crisis, where we don't have a lot of answers. In the UK and Japan, they have ministers of loneliness, and loneliness can build. Anyway, we can build social prescribing programs to work on people's loneliness. So what about our healthcare worker crisis? So doctors could feel good about what they're giving to patients. I think it is a real issue that we don't necessarily feel good in all the things that we prescribe that cause side effects. And here is something that, you went out this weekend to go to the parks, and you can talk about that with your patients. And also, I believe, as Barbara mentioned, I worked for several years around COVID at trying to bring the arts to healthcare worker well-being. But I think a social prescribing program could be a beautiful addition when we're looking at well-being for our staff. Our civic crisis, people could be engaged with others doing the things they love. And as far as our aging crisis, really healthy behaviors, we could address isolation and also take a look at the caretakers as well. So I am a big believer that healthcare organizations have to take care of our own people. as part of taking care of our community and our patients. So looking back at Maria, what if she got a social prescription? She was connected with a social worker or a community health worker, connected her with medically tailored meals, connected her to a local walking group of other moms at the park, because she could work on a community mural or sing in a choir. She could be connected with a volunteering organization to help other immigrants. So one of the superpowers, I think, when you look at social prescribing is going beyond volunteering. When people actually become, going beyond showing up and being somewhere. If people get to the point where they're actually volunteering, it's really a whole nother level that people can have healing if they have an identity around it and they are able to really help people. So these things that we're talking about, they're multimodal, they're more complicated to study, but they're generally appealing things, they're low risk, they're cost effective. So when you look at the arts, you have the traditional for music, visual, language, and dance, but also culinary, textile, gardening, all of these things work. They've all been studied. We don't have to actually repeat all those studies. We have, as I mentioned, 30 to 40 years of data basically proving that. If you want to learn about it, there's a book that came out, Your Mind on Art, that came out in the last couple of years that really documents a lot of the data around this. And the arts are very profound in what they accomplish. They help with the immune system, they help with hormonal regulation, decrease blood pressure, decrease heart rates. And then you look at these outcomes, and they're just incredible. No drug that I have ever heard of can decrease pain by 25% or 50% lower depression or 44% lower dementia. So I think, we do have to compare apples to apples and think about these are real outcomes happening for people, and these are tools that we're really not utilizing at the level that we should. These tools should be available to everybody if they're getting these kind of outcomes. And this is a slide that we just had an event called One Nation, One Project. I'm not sure if any of you got to attend, but 18 cities on the same day last July, I think it was July 27th of last year, all did engaging arts events. I got to attend the one in DC, and it was just powerful to see how people were engaging. It was a lot of booths with different things. They had live music playing, they had poetry, they had people doing dance. So it was just exciting to see what it could look like when arts is available for everyone. So we talked a little bit about nature already. Volunteerism, there's great evidence around it. Lower risk of high blood pressure in the elderly. If you take the 70 plus population, you have a slower decline in people's health, decreased depression, improved mobility. If you take vets, there's a decreased PTSD and depression. So we got a lot of evidence for that. Movement, I probably don't need to convince you, but less depression, movement is about as good as antidepressants for mild to moderate depression. But also, if you look at the brain, you could just get a decreased loss in the brain around moving and exercise. And then social connection. So social connection is, I know that Teresa is going to talk about it as well, but decreased hospital readmissions around heart failure. It protects people in a lot of the population you're working with around aging and Alzheimer's and dementia. And also it increases people's willingness to actually take their medications and follow a medical regimen. So this book came out last summer, The Connection Cure, and this was the first book to come out in the United States around social prescribing. And it's really powerful. You want to go to one place to start. I think this is a great place because Julia went around the world and she interviewed people to find out what it is that people were doing around social prescribing. A lot of it wasn't happening here as much. And really since then, the last half of last year, it's been amazing just how much press has come out. The New York Times had an article. There's been Time Magazine. It just seems to be everywhere, partly because people are really appreciating loneliness and social isolation and just how much it needs to be addressed. So social prescribing seems like a natural step from there. So I'd like you to think about doing your own social prescription. What could you do around the arts, nature, community, movement, service to bring this more into your daily life? I mean, it could be 5 minutes of playing a little piano, or it could be taking a walk out in nature. And these things are huge. So think about what you might be able to do for yourself, because I think it gets harder for us to prescribe these things to other people when we're not doing them. And one of the beautiful parts of this is that it really works with health equity. The people are making their own prescription with the link worker or with someone in that role in an ideal way. And that does bring health equity. It's very individualized for that person, and that person has input as far as what's on that prescription. So it's about them. And it kind of brings back this WHO definition of health, where it really is the complete physical, mental, and social well-being, and not just the absence of a disease or infirmity. So this is really looking at health in a different way. While this definition's been out there, I don't feel like that's what we've been doing in healthcare to really look at certainly the social well-being. So I'd like to talk a little bit about Social Prescribing USA. I think that's probably my job as a executive director. But what we have available to you is a lot. If you want to learn about social prescribing, it's a great place to go. So you can start off by signing up for our newsletter. We send it out monthly. We try to keep people up to date on what's going on around the field. We have a website that we just got a new website as of January, where we have lots and lots of evidence from both United States as far as around the world. We have initiative mapping that, in 2025, we want to do a mapping of what's actually happening in the United States. There's stuff we know about, and then we know there's stuff that we just don't know about. So we really want to take this year to get our hands around what exactly is happening that would fit in with social prescribing. We are an advocacy organization and are working to make this available to everybody. We had set 2035 as our goal. So for now, we're sticking with that goal. We facilitate. So we have a community of practice that's 260 plus strong. So these are implementers from across the country. You can become one of them who are making this work happen at different stages. And so we meet monthly to go over best practices and have discussions around it. And we're going to be expanding what we be able to offer to that community of practice during this year. We have a health professional champion group, which we just started in the fall. Again, we're bringing in speakers, we're meeting. I'm hoping that we eventually get to a place where we can offer training and advocacy so that people can go back to their own systems and their own legislatures and be able to advocate for bringing this work into more mainstream medicine. And we have lots of webinars and events. And then we are leading. We're identifying best practices. We're guiding the US to be a leader and to work with our global partners around social prescribing. So how do you get involved? One of the most important parts. So join our newsletter. Go to socialprescribingusa.com. The community of practice is an amazing group, and we're just going to be increasing the networking that people can do among that. So if you want to get things going, there's likely people in your area that are already doing the work or connected to it and can be amazing partners. You could join our health professional champion group. It sounds like the audience for this group would be appropriate to join that. We have an upcoming event. So we believe that people need to start getting together and talking about this stuff. So we worked with Benjamin Goldberg Foundation, and we're supporting the launch of this summit. It's actually just set today as April 30th. But we put together, they mostly put together, we helped a bit to put together a guide for doing summits, to doing local summits, because we feel like this needs to happen all around the country. We've been involved with a couple of them, two in New York and one at Harvard, and then Benjamin Goldberg had theirs in Virginia last September. But that these are really powerful experiences where you bring in the stakeholders into the room, and the things that have come out of these have already been incredible. So some of the things that have come out, they started a group that met quarterly. They decided to put on a conference. So they're already having really amazing outcomes just from these summits. So we encourage people to do that as a way. So this summit toolkit really makes that easy for you. Get involved locally or contact us at info@socialprescribingusa.com. And some of the things that you can see on our website, you can see some facts. Oh, I think I went back. So a lot of the questions and answers that come up around social prescribing, uh, yeah, this is a new area, and still most people I talk to have never heard of social prescribing before. People I meet, the word is just getting out there. It takes a long time to get this kind of thing out. The UK, for example, has had this to be public policy and widespread since 2018, and yet only 20% of the population have ever heard of social prescribing. So it's not surprising, but this may be the first time you've ever heard the term. So there's lots of questions and answers, I think, around that as you're like, is this something real? And then there's the evidence library, both from the US and global, how to get involved. And then we have lots of webinars that are there. So if you want to learn about it, I think it's a good place to check out. And this is the beginnings of our mapping project. So if you want to go to our website and you click on any of these places, you can find out what's happening in these different places. There's journal articles connected, there's their website, and so you can learn about what's happening, and we plan to fill this in, hopefully all 50 states this year, but at least filling it in for what's happening in the United States, and then trying to help it happen more. So I'd like to share with you about some of the amazing programs that are going on around the country. And I think it's really helpful. I didn't really include as much about what's happening internationally because it is another world here. And we have 900 healthcare systems. We don't have one national health service. It's just a very different environment. And so I think how it's going to look in the United States is going to be very different than how it looks in other countries. So some examples of just what people are doing. So this is one of the amazing programs called Arts on Prescription. That is where Horizon Blue Cross Blue Shield joined with the New Jersey Performing Arts Center, and they brought in their high utilizer patients. And for those patients, they connected them with New Jersey Performing Arts Center. And they have programs both at New Jersey Performing Arts Center and about 15 other locations. And they have been very successful in the initial stages, enough that they just got a $150,000 grant last year to be able to continue their work. The UJA Federation in New York has a program where they connect with the largest healthcare company in New York called Norwell Health. And they're supporting people living both in healthcare facilities, but people also living independently. So they have connection specialists, which is their version of a link worker. They actually just had a training 3 days ago where they brought someone from the UK to train people to be link workers from the place that kind of invented the term. But anyway, they're expanding their work, and they are showing how they're reducing isolation and loneliness. And the way that they're doing that is they're connecting to organizations in the community that are doing that work. So you don't have to invent all the pieces, you just have to put the pieces together. This is a field guide called Arts on Prescription that I think came out about 1.5 years ago. And, it is a great way to sort of look at thinking about systems and just starting at one of the pieces of the system. So it also has a lot of great references in it. And this is a program called Project Connection. So Project Connection has about 40 therapists and 5 link workers, really based on how this was done originally in the UK. And they really go to the question of what matters to you. And when you ask, one of the people that asked that question to was an amputee, and what they wanted was like a group for amputees. So they really helped that person connect with it. So again, you might be surprised of what it is that people need when you actually ask them. It's a program called Parks RX America. There's about 1,600 or 1,800 physicians who are signed up, but anyone can sign up, either themselves or any health professional can sign up. And you today can go do this with a patient. There's 1,500 parks connected, and there's going to be 3,000 shortly. And you can help write out a prescription in the room for a patient. It takes 2 minutes, and be able to set that expectation up. We actually, where I'm working, we're going to try this out among our staff to see how it works. And I think, again, my belief is that you really have to do this stuff in order to buy in that you're going to start doing it with patients. So that's what we're going to try doing. This is a program called Open Source Wellness. This is actually based out of Oakland, California, where I work. And what they do is they have these health coach-based groups. And I got to sit in on one of their groups as well. They do movement, they do nutrition education. They have a coach for that group. And and then you can look at the outcomes, and they're, like outcomes that you don't see in other things. And this keeps happening. 77% decreased emergency room visits. I mean, that is probably the most expensive place that we have. Blood pressure, physical activity, depression, social isolation. So, you know, this stuff works. If you get a chance and you want to learn more about this program or about the founder, Elizabeth Markle, did a TED Talk called Community as Medicine. And I just think it can be really eye-opening and life-changing to just check out the TED Talk. 14, 15 minutes. But I think it's super powerful. Walk with the Doc, I mentioned before. This is a simple program started by a cardiologist in Ohio and has now spread to 600 communities around the country in 39 countries. And basically, this is the simple idea. You get a site license and you just take walk with patients. And so we used Walk with the Doc to do a much bigger, wider spread program at regional parks. But you can just start this, tomorrow and have people walking with you at lunch or after work. And you'll see that just that itself is a huge, powerful experience to have both for you and for the patients. This is a program that I love as well called Carolty. This is now in 10 countries around the world, including the US, in Florida and Tennessee. And they basically assess people. They figure out what their needs are and whether they need a little bit or they need more support. They're able to rise to that occasion, and they connect to them with free activities in the community. So I think just the fact that everything they do is free is very helpful when you look at funding. This is a program called Art Pharmacy that is based out of Atlanta, but has now spread to the Northeast with the state of Massachusetts is now working Mass Cultural, where anybody in Massachusetts can get referred to one of 200 different organizations doing arts in the community. They've also spread to Stanford to work with the undergrads. And they're basically act as the link worker. So the referral is done, it's done in the computer, it's connected, you express the kind of things that you want to do. They help give some ideas. You decide what you want a dose of. You get 12 doses over a year. And then that feedback loop goes back after the experience. Did you have a good experience? Okay, you can do that again. Or if not, you can do something different. And then after a year, you might need a refill. And again, these are their outcomes. 67% less loneliness, provider satisfaction, which I work at Kaiser, those kind of things are incredibly important at 94%. So these kind of numbers you just can't get with medications and with what we're doing now. So Art Pharmacy is doing good work. I'll quickly go through some of these, but VA has programs around the country where they use volunteers to work with some of their vets and also have great outcomes. Cleveland Clinic has a program where they send people out to nature and arboretum, as well as some arts, dance, visual art classes. Dance for PD, I love this program because it's already an established part of the healthcare system. So a neurologist, as part of what they do, they send somebody to Dance for PD because that movement really changes that person's trajectory. And so they're able to really accomplish a lot, and they've been around for a while. So I think they're a great example of social prescribing before we had a term for it. So how does this connect with what your system might want to do? I'm at Kaiser, and so I kind of know what they want to connect with, but I think that it's probably pretty similar with things that other systems want to do as well, and that they want to do community health better. They want to do equity integration and innovation, prevention, wellness, and mental health and loneliness, that we need more tools for that. So social prescribing really lines up with a lot of these priorities, and therefore I think it is really where we should be going in healthcare. Thank you very much. If you use the QR code, you can get a bunch of references to social prescribing. You can also go to our website, socialprescribingusa.com, or send us a message. And thank you very much for having me speak, and I look forward to questions. And now
Thank you
I
so
will
much.
pass
If
that over
we
to Teresa.
Do you
Yes.
want to take questions now or at the very end, Dr. Siegel and Teresa?
Yeah,
Um,
I think it's better to do it at the end. I'll have
okay,
Teresa speak and
so
then.
we'll go ahead and if you want to stop sharing your slides and Teresa can put hers up. And thank you very much. What a tremendous amount of incredibly creative programs. I appreciated learning about all that.
Okay, thank you so much. Let's see here. Can you see my screen? It's telling me my screen sharing is paused. I'm not sure why that is.
Do you want to try stop sharing and starting
Yeah,
again?
let me start. Yeah, it worked when I tried it earlier today. Okay. All right, let's see here. Okay. Give me just one moment here.
Angela, do you have any suggestions?
Um, yeah, good. Um, Let me see. Have you started sharing? Double click.
Yeah, no, and when I was trying it earlier before we got started, it allowed me to do it. So it's asking me now to approve sharing in my settings, which I have done. Let's see here. Is there any way, Barb, that I can send the slides to you and you can share
I'll put
them?
your slides on and you just let me know when to
Okay,
advance them. How's that?
perfect. Thank you. There we go. Yeah, and if you want to put it in slideshow mode, and then Barb, some of them have the animation in them where you have to, I'll just say click and it'll take you to
Okay.
the next thing that I'm going to talk about. So, all right. Thank you so much, Dr. Siegel, for presenting with me here today. It's an honor to present with you. Thank you to Barbara and the Northwest Geriatrics Workforce Enhancement Center, and to everyone who is here participating today. My name is Teresa Tam. I am the Social Connection Program Coordinator, and I'm with the Greenwood Senior Center, which is under the umbrella of the Phinney Neighborhood Association in Seattle, Washington. And we are celebrating 45 years as an organization. And so I'm here to tell you about our Social Connection Program. Next slide, please. All right, so why did we start this program? This program has been running now 4 years as of this month. Our recently retired Greenwood Senior Center director attended a social isolation impact summit put on by the Motion Picture and Television Fund in 2020 when we were at the height of our pandemic isolation. And she thought to herself, you know, I would really like to bring something to the senior center that puts a focus on social isolation and loneliness and enhances the work that we already do at the senior center and through the PNA or the Phinney Neighborhood Association. So she had funding from the King County Veterans, Seniors, and Human Services Levy, and I started in my role. It'll be 4 years as of in 9 days. It'll be 4 years ago that I started and have been in the role since we got started. Next slide, please. Okay, so Dr. Siegel talked a bit about social isolation and loneliness, and I just wanted to put this up here to provide some definitions, because you will oftentimes hear these terms used either together or interchangeably. And interchangeably is a bit of a misnomer. They're related, but not the exact same thing. So social isolation is typically referring to the objective lack of social contact, the actual number of people that you interact with on a day-to-day basis, whereas loneliness is a bit trickier. It is subjective. It refers to the perception of social isolation or feeling of being lonely. Next slide, please. So, as Dr. Siegel mentioned, you know, these are loneliness and social isolation are social determinants of health. And this is a graphic here from the World Health Organization. You can see their health risks, up to 50% increased risk of developing dementia, 25% increase in rise of early death, and up to 30% increase in risk of stroke and cardiovascular disease. Next slide, please. And then here is the prevalence based on one poll. It's an annual poll that the University of Michigan does. It's called the National Poll on Healthy Aging. And you can see these are from October 2018 to March 2024. You can see changes in feelings of social isolation amongst adults 50 to 80. And it's the percentage of older adults who felt isolated, so who were lonely from others, some of the time or often in the prior year. So you can see we're still at, roughly 1 in 3 older adults saying that. That's not a small part of the population. And in 2020, you can see we were over 1 in 2. But even before that, the pandemic did not cause social isolation, it just exacerbated it. And it was still, roughly 1 in 4 in 2018. All right, so if you can go to the next slide, please. All right, so what are the goals of the Social Connection Program? If you can click through these, Barbara. So to help older adults form relationships, foster belonging, create opportunities for purpose and meaning, and ultimately reduce social isolation and loneliness. Next slide, please. So when I started, we didn't have a template. We just started doing things and to see where we went. And as we went on in the first year, we figured out that what we were doing was roughly falling into 2 main buckets: community outreach, so engaging, educating, and learning from the community, and then also developing new programs. Next slide, please. So here are some of the community outreach examples that I've done. So in the beginning, it was mostly about learning from the community. Before we started trying to develop programs, we wanted to know what people in our community were experiencing as it pertains to loneliness and social isolation. So I did a lot of focus groups with participants at our senior center, at Seattle Housing Authority, senior residences, with faith-based groups, with their older adults. And we've also done a number of surveys in the community in partnership with the University of Washington graduate students to get information. We didn't have any brochures for the senior center, so I made that, and I have been distributing those through places like Meals on Wheels, at senior housing resource fairs, food banks in the community. And you can see me here. This is at the Phinney Farmers Market. I'm there every summer, talking about Greenwood Senior Center's programs, as well as social connection programs. And obviously doing presentations. I've done quite a few presentations on this, both locally and nationally, participating in national forums. I'm part of the community of practice with Social Prescribing USA, and very excited about where that is going to lead. There's also, if anyone else is interested, there's a forum called Commit to Connect, which is a great forum for people who are working in the social connection space. And then I've done a fair amount of community mentoring. I've helped other senior centers and community centers put on some of the programs that we've developed. And I've also had people contact me who want to know more about what we're doing and how they can implement some of the programs that we have through the program. Next slide, please. All right, so we're going to click through these as well. So if you can click again, Barb. Okay. So the fun stuff are all of our programs. So you can see folks here chatting, and these are folks participating in speed friending. So this idea came out of one of our surveys that I mentioned. Our older adults were saying that they wanted more opportunities for one-on-one connections, and speed dating was mentioned in particular, but we decided we wanted to be a bit more inclusive, and we created speed friending. And we've done this 5 or so times at our senior center as well as other senior centers. And we have, a number of great stories that have come out from this. I had one woman who came back a second time because she said, I met my best friend the first time I came, and she wanted to meet more people. And there was another woman who had figured out that there were a bunch of people that were there that lived on her street or very close to her on 72nd Avenue in Seattle. And so they started a monthly supper club and called themselves Club 72. So that was really fun. Backup plan for solos. This is one of my passion areas. I am a solo ager. I don't have any children. I don't have any siblings. And many years, even before I started this job, I started to think, who's going to do all the things for me that I do for my parents? So I lead what's called Backup Plan for Solo Groups, developed by a woman named Linda Camp in Minnesota. And it's a 6-week program where people come together and they help each other form a roadmap for who is going to be on their support team if they need help as they age. And for quote unquote graduates of this program, I also have an alumni group, a solo aging alumni group that still meets once a month throughout the year, and they can talk about anything related to solo aging. Click again, please. And then a spinoff of that is social solos. So the backup plan for solos is very structured. It's very much about resources and talking about what you're going to do for your plan. But people were saying, well, I'd like to get to know these people as well. So I've started social solos, which is just tea time and cookies and a chance to get to know one another. Click again, please. All right, and so as we've been doing this work, and probably not surprisingly, I was discovering that, a number of people were coming to events, but feeling like they weren't really connecting. And we decided that there was probably some need for some social skills practice. So how this started is that we've read a couple different books and discussed them. The most recent one being the David Brooks How to Know a Person book, and had some great participation and discussion with that. I've done that, collaborated with another staff person at the Greenwood Senior Center, as well as I'm doing it at a different senior center right now with the geriatric mental health specialist there. And then from feedback on that, we were hearing from folks that they enjoyed it, but they wanted more opportunity to practice what they had learned. So now we have a once a month practice group where we do one particular exercise each time, and we practice it one-on-one and then in a small group. Next, click again. And what I also discovered through the first year or so is that when I was doing outreach and I was handing out flyers and brochures, people seem very overwhelmed by all of our programs. The Greenwood Senior Center has a lot of programs, and I've just been adding to it. And so, people don't really know where to start. And so I came up with the idea of having just a 30-minute consultation where people have a safe space, a point person where they can talk to me and express to me maybe things that they are embarrassed to admit to others, that they feel lonely, they feel isolated. And then I talk to them about their interests and tell them about some activities, and then they are on their way. Click again, please. You'll have to click again. Okay. So we've talked about nature already. Dr. Siegel talked about that. I love forest therapy. This is some of our participants doing forest therapy in one of our many beautiful parks in Seattle. For the past couple of summers, we have partnered with Cascadia Forest Therapy, who are certified forest therapy guides. And forest therapy, or forest bathing, as it's also called, has been shown to have great physical and mental health impacts. It's also shown that it can decrease loneliness. Being in nature makes you feel more connected. So forest therapy has been a really great opportunity for people to feel more connected to both nature and their fellow participants. We usually end with a little tea circle where we talk about our experience. Click again, please. The Unlonely Film Festival is not our festival. It's a national film festival that has an annual call to artists to submit short films on the topic of loneliness. And each fall, I select 3 or 4 films, and we watch them together at the Senior Center and discuss them. Click again. And then Connect to Effect is a 1-hour program developed by the AARP Foundation. And it's similar to what I'm doing in the consultations, but a little bit longer and more structured. So they came up with this idea of having people create a friendventory. So people take a piece of paper, they write down 5 people that they either have lost contact with or would like to know better. And then they come up with specific concrete ideas. So kind of a social prescribing for themselves, where they think about what they could be doing to be more in contact with those individuals. Look again, please. And then Connection RX is an offshoot of that. This is a program that I have developed, learning from other social prescribing programs that are out there. And it is really kind of an enhancement of Connect to Effect. So in the consultations, in the Connect to Effect, I was noticing, or I was thinking to myself, okay, these people are here, they're doing this, they seem like they got something out of it, but then they go home and then what? Are they actually implementing their friendventory? Are they actually following up with these people? So you can go to the next slide, please. So Connection RX is what we're referring to as a 6-week social fitness program, and it is our social prescribing program. Right now, we're currently just piloting this and we're just working with self-referral, but we hope to eventually move on to working with physicians so that it can actually be social prescribing from medical professionals. So during these 6 weeks, participants are committing to doing 1 new activity a week and then coming to a meeting once a week, currently with myself in a small group. I'm facilitating with other participants. And they're also committing to doing a daily loving kindness practice. So research has shown that when we're lonely, we become internally focused. We put our guards go up, and it really can hinder us in how we are connecting with others. So the practice of loving kindness or compassion has been shown to switch that focus outwardly instead of inwardly. So we are bringing down those walls, opening up to other people. So I ask people to do that as well, because it's not just about how much they do, it's how they're doing it. We are a lean start pilot. We have no funding for this. It's just me in my 20 hours a week doing many other things as well as this. So we are hoping to grow this program, as I mentioned, and I'm very interested in working with any healthcare professionals, folks in the insurance area in Seattle, anyone who's a data nerd can help me with evaluation. Would love to hear from you because we'd like to grow this. So how we progress, we've been doing this for about a year now, and we've been trying out different things to see how they work with our small senior center. So we started with a concept as coaches and participants, which is the closest to what the UK is doing with their link workers. So we had some peer volunteers, people who are either retired counselors or have just done a lot of this type of facilitation work, and they were paired one-on-one with a participant, and that went really well. But the problem we were finding was that we're a small organization, so having the correct number of coaches to participants at any given time was very difficult. So we decided to switch to PALs. So that way it's just participants. You're meeting one-on-one with a PAL. You're each participants, but you're meeting together and trying to accomplish the same thing that coaches and participants were doing. And that logistically was a bit easier, but we were finding out that people weren't understanding what this was all about. People were thinking it was a dating service, or they were, wanting to meet their best friend, and they weren't understanding the whole social prescribing aspect of it. So that has led us to where we are right now, which is small groups. So I'm the facilitator. You could say I'm the link worker. And that has worked well. We've only done one so far. I'm doing another one this spring with a small number of people. That's good in that we know exactly when the groups are going to be held. The con to that is that, if you're working on one-on-one with someone and you get sick, or you have something else that comes up, you can just reschedule. With a small group, we have 6 meetings and they meet when they meet. So if you miss meetings, you miss meetings. And also, if we are starting to get physicians involved, people will refer to us, and then that that patient may have to wait for a while before the next group starts. So we have not decided which way we want to grow quite yet, but those are the three options. Very limited data to date because we've only had 12 people participate in this, but we do have anecdotal data. I had one woman say, I got so much more out of this than I was expecting. I had another person say, it really helped me learn how to break down the walls that I had put up in interacting with people, but also to create healthy boundaries so I'm not letting people walk all over me. And I'll show you a bit of quantitative data on the next slide. But as I mentioned, next steps are to expand this pilot. I'm hoping to get another senior center involved in Seattle, hopefully one that's in a more racially diverse part of the city. We are in Northwest Seattle, which is predominantly white. And so I would love to partner with another organization in Seattle, and then to get physicians involved, maybe some med students or other people who are very gung-ho about bringing this into their practice. Next slide, please. Okay, so here's some very limited data. Take it with a grain of salt. It is not at all statistically significant, but it's promising and that we are hopefully heading in the right direction. So I've been using the UCLA 3-question loneliness scale, which is a validated tool, to assess participants with ConnectionRx at the beginning and at the end. And these 3 questions are: how often do you feel that you lack companionship? How often do you feel left out? And how often do you feel isolated from others? And they can answer often, some of the time, or hardly ever. And you want to move them from often down to some of the time, down to hardly ever. So this is a summation of responses across all 3 loneliness scale items. It's also a summation across the 3 different types of pilots that we've done, the coaches, the PALs, and the small group. But you can see often is the red part of the pie. And from pre-assessment to post-assessment, there has been a reduction in that. So that is encouraging to us. Next slide, please. So what have we learned so far overall with the social connection program? Definitely no one size fits all, and concierge is key. Having that point person so that someone can feel comfortable opening up about this, and then learning, getting a bespoke idea of what might be good for them is very important. Loneliness is a lot harder to address than social isolation, probably not surprisingly. If someone comes to speed friending, when they leave, I can say definitively that they are less socially isolated than they were when they came, but are they less lonely? Did they feel like they connected with anyone there? And then targeting quality in addition to quantity, as I've mentioned, through practicing compassion and those type of things that people have a lot of reasons why they're socially isolated or lonely, and some people just maybe they just moved to town, they just need to meet people, but other people really have some underlying reasons why they are isolated or lonely. So targeting that through programs like ConnectionRx, the social skills, the counseling or consultation, is very important. And last but not least, collaboration is critical. So my counseling partner that I work with at the Senior Center, also at the Wallingford Senior Center, I've been working with Age Friendly Seattle with a community of practice there of other people that are interested in this topic. And obviously collaboration will be critical as we try to expand ConnectionRx, because in order to get a physician to want to prescribe this to someone, it can't just be our little senior center. It needs to be at least the whole city of Seattle, so they know that there will be a place that that patient can go to. Next slide, please. And then here is just some data on the impact of the social connection program overall. Out of 144 responses, 85% of people agreed or strongly agreed that they felt more connected to others or had more resources to increase their level of social connection because they attended the program. Next slide, please. And 95% agreed or strongly agreed that they would recommend this program to others. Next slide, please. All right, and that is that. Here's my contact information. I'm sure that will be sent out as well, but I would love to hear from you, particularly if you would like to collaborate with Connection RX. And that is it. Thank you.
I am so excited to hear about both of these programs that actually encompass so many diverse and creative program ideas. It's very, very exciting. I have a question that was raised that said these programs are great. Are you all looking to bring these sorts of programs to the east side, Bellevue, Kirkland, Redmond? There are BIPOC seniors in these areas and it is isolated and lonely for them.
Yes, I would love, contact me. I'd love to talk to you.
Other questions from folks? Please put them in the chat. And while they're thinking of questions, I would love to ask both you and Dr. Siegel your thoughts on introducing these programs within different settings and focusing on different disciplines, sort of shepherding them through. What have you seen in terms of that variety? We've heard about it, quite a few of them, but there are broader communities and disciplines that are engaged with older persons.
Dr. Siegel, you want to take that one first?
Yes, sure. I think, as I kind of mentioned, and it was great to hear about your programs, Teresa, by the way.
Thank you.
I love hearing about this stuff that I love. So I think that, these programs are going to all look different depending on where they are and who the partners are. We are, there's a lot of social prescribing happening out in the world. If you consider a church having events out in the community, I mean, that could be called social prescribing. We're trying to concentrate more on the integration with healthcare and healthcare providers in ours. But I think that there's some great ideas in the field guide. Teresa sounds like has gotten some great ideas from the group. I would urge people who have an interest in doing this to really join the community of practice. I think it's an amazing group of people, or the health professional group, to really get ideas of how things are done. The goal of one of the many goals of the community of practice is to be able to bring questions about how to make something happen in a different environment, because you are often the one, you as the champion are often the one having to figure out how to navigate territory that has not been done before. My approach, as I'm new to Kaiser, I just started here in August, is to look for systems that already exist and connect to them. So in my system, there's a social health program that looks at social determinants of health, and I am partnering with them as well as community health to see how do you build this into a system. When you're trying to do something completely new that doesn't really connect, I think it's a lot harder to do in healthcare.
I'm going to
Yeah.
post something in the chat because I just got notified of this. This is in the Seattle area, and some of you may know about it, but it's Dancing with Dementia at the Fry Art Museum that sort of taps into some of that art and social connection that you both have been talking about.
Yeah, they're doing great work at the Fry, so that's highly recommend.
I'm sure that you've had connections, Dr. Siegel and Teresa. You're aware of the sort of neighborhood associations throughout the greater Seattle area. Are you connecting with those, or are you fairly located in the Phinney neighborhood area? But people sometimes tap into your programs from outside those areas. Is that correct?
Are you asking other community centers? Is that
the neighborhood associations where they've had those kind of virtual connections among people living in the same neighborhood that can help each other? So they've got service focus, but also
okay?
communication focus.
Yeah, are you
activities.
talking about the villages, the
Yes,
village to village
that's the word
network?
I was thinking of.
Yes,
Yeah.
yes. Thank you for bringing that up because I was going to mention that and then I forgot in my talk. Yeah, we at the PNA, we actually have a village. We have the PNA village,
Hmm.
and we serve Northwest Seattle. And there are 4 or 5 other villages in the greater Seattle metropolitan area, and they are wonderful. I'm a huge promoter of villages. Whenever people join my solo aging groups or Connection RX, I'm like, if you are not a member of a village, you should be, because these are, it's neighbors helping neighbors. It's people helping provide services to help you age in place in your home, as well as a lot of social opportunities.
And I just wanted to mention and put in a plug for the social prescribing website, the sign up for the newsletter, because I found that to be really informative about what's happening broadly, as well as just thinking through considerations for social prescribing and possible programs that could be instituted in people's area. Do you, Dr. Siegel, solicit for input on so that you kind of compile programs that are available, or how do you get that in for all of that information onto your website and newsletter?
We want to know about programs that are happening that we don't know about. So if there's stuff that's not on our website, I mean, that is really some of the work that we're looking to do. So we have a volunteer team, including myself, who are kind of trying to follow what's happening out in the world and articles and we, bring that together, books that come out. Um, a lot of the stuff around programs comes through the community practice because we're highlighting one each month to let people know about an example of how do people do things, and then we interview them to get more in depth about like what's the method that they did, and try to bring that to others. Because I think that we all just need to learn from each other. We don't need to reinvent this stuff. Um, and then, Teresa's starting some of these programs de novo, of really great programs to address the community. But I want to encourage people that you don't always have to do all that work. That if you look in the community at what's out there already, there's already probably some amazing stuff happening. And I feel like part of what you can really do in social prescribing that doesn't have to be that hard is just you're connecting a health professionals and healthcare system to what's already happening in the community. You don't actually have to invent everything because it's overwhelming. I was just looking today around Oakland and kind of asset evaluation for what's around here, and there are 500 programs, and I have to look through this list to try to find like which ones are the most relevant. But there's just so much already happening in our communities. There may be less in some of the smaller communities and rural areas. We are actually going to share some information about the Mountain West and some grant opportunities for rural areas. I think, some of that may be more challenging because there may not be so much going on already happening in the community. But I would urge people to really like do a search. Somebody told me you can basically feed it into ChatGPT for your area, feed in the right things. What are the arts programs? What are the connection programs? And you can kind of do your own asset evaluation of what your asset mapping for your area. So I would encourage people to not have to start off by creating your own programs because I love that stuff and that's what I've done for the last 25 years, but it's a lot of work and you have to like get a lot of permissions and stuff.
Well, and that's a good point, because there are a lot of people who have done that work, and if you tap into those folks, then um, you can get their information. I think about in the Seattle area, the public libraries, parks and recreation, the villages. Phinney is just a tremendous resource, has always been. I wanted to mention that Maggie Pheasant mentioned that she's a member of Wider Horizons, a village in central Seattle. She still participates in Zoom conversations, although she moved to Spokane. She said this is a great and mature organization. WiderHorizonsVillage.org. Denise Klein is the executive director. And I think that there are just many, many opportunities. The Fry always has quite a lot going on. And I think in any of your areas, If you check in with museums, with Parks and Rec, with libraries, you're right, Dr. Siegel, there are already a lot of programs going on to tap into. I actually wanted to ask Teresa, since Phinney is near the zoo, are you connecting with programs at the zoo?
Yeah, definitely. I mean, we do forest therapy in Woodland Park, which is right there by the zoo, and we have a really robust memory loss program with the Greenwood Senior Center as well. They do zoo walks. I don't know how often it is, but they do zoo walks. So yeah, we definitely have done a number of things with the zoo.
Yeah, one idea for whatever zoo brought up the idea is that some of the really beautiful programs, I think, when I was in New York and went to their summit from the UJA, that were brought up were programs that brought together aging folks along with young people, and to young people to come in and volunteer to work with the older people. And then sometimes it's, you can't tell who's benefiting because they both benefit from the volunteering experience and then from the aging. So I think if you want to think about interesting things to do, I think that, starting to think in ways like that, we just, younger people have so much to learn from our aging population. And so I think that that might be a nice ways to combine resources.
We have had connections in some of our elementary schools connecting children with older adults who are reading them stories and things like that. And then I think I think it's in Scandinavia where they have some high-rise living arrangements where students are living and supported for that living, but they also connect and make a very strong companion connection with a person that's also in that community. So there's a lot of really creative ideas.
There's also in Seattle, over in West Seattle, there's an independent living and assisted living facility that has a daycare in it, and they do a lot of intergenerational things
Oh, nice.
there.
So Maggie said that when she moved to Spokane to live in an intergenerational co-housing community, Haystack Heights. There are several co-housing communities there, mature and forming in Western Washington. Requires being healthy and willing to volunteer in the community most days, gardening, creating meals, childcare, maintenance. She's happy to talk with anyone interested. There are at least 400 communities in the USA. So I don't know, Maggie, if you're willing to put contact information for you for others. Well, I think this has gotten everyone thinking very carefully and expanding their perspective on possibilities, and that may be why we're not seeing as many questions because people are still thinking about what are some options within their areas and how might they search to find out programs and support. So I think that we will probably close off unless there are any other questions. And I really want to thank, along with others who have expressed this, that you both were sharing the tremendous resources that you've set up and the considerations for addressing social prescribing and social connections with older persons. This was just really exciting and brings a lot of hope for the future, I guess I could say, as an older person myself.
I
Thank
will throw
you.
out one
Thank you so
more.
much.
Yes, thank you. I just one more idea of just because people are approaching me with all these different things that they're doing that are completely different. One of them, the other day, I met with a person who started Block Party USA, and just block parties were a big part of their childhood. And so I think, and they're a resource. They've written go to their website. They sort of have a small nonprofit, just thinking, how do we start connecting in just ways that are healing? And because we've become this sort of separate thing, and that's not working very well. So just how do we reconnect in ways that are important at a basic level? That's what social prescribing is. We use tools like arts and nature and other things, but it's really about getting people connected.
Yeah, tremendous. Thank you so much. Truly, as Shannon said, an inspiration. We'll see all
Thank
of
you
you
very
next
much.
week, same time, same place. And thank you so much to both of you for sharing your expertise and perspectives on these programs and possibilities.
It was a pleasure. Thank you for having me.
Yeah,
Thank
thank
you.
you.